Good morning. Have you ever woken up out of bed in the morning and grabbed your back and thought, oh, my aching back? I've, I've done it. I have somehow tweaked my back in the middle of the night. I've tweaked my back bending down to pick up the dog recently. How else have I done it? I know my husband tweaked his back putting a sheet over top of our mattress. So it happens, right? But a lot of people also live with chronic back pain or have had back issues for years and years. So when Dr. Haynes' people reached out to me to see if I wanted to have him as a guest on the podcast, I'm like, yes, I think this is an issue that a lot of women deal with. So, who is Dr. Colin Haines? Well, he's been recognized as a 2025 Castle Connolly Top Doctor, which is an honor awarded to the top 7% of physicians worldwide. Wow, that's tremendous. He's also performed the world's first endoscopic and robot-guided spine surgery. Dr. Haynes is here to break down how menopause can accelerate bone loss, increase disc degeneration, and even heighten pain sensitivity. But more importantly, what you can do about it. This conversation could change the way you move, train, and protect yourself for the future. So let's welcome Dr. Haynes to the podcast. So I had to spend a little bit of time looking at your website. And of course, it led me right to some of the Google reviews, which is looking at these, it's just tremendous. So many 5-star reviews, but people literally commenting that their life has been changed. Someone says, it's hard to describe how thankful I am to Dr. Haynes and the entire VSI team. I had a herniated disc at the beginning of the year, developed sciatica, which has been painful, but he has helped me to feel tremendously better. Other reviews, Dr. Haynes was amazing from start to finish on my neck surgery. He's very knowledgeable, skillful, caring surgeon. I highly recommend. I mean, I could go on and on, but that's tremendous. That's amazing. How does that feel for you? And so many of the reviews were like, he's literally changed the trajectory of my life and health because I was in so much pain and could do nothing. And now look at me. How does it feel as a surgeon, as a person, to be changing people's lives like that?
Oh, well, yeah, thank you. It's really cool. I mean, there's just no other way to say it. It's something that, I never get numb to that feeling. It's as someone who's had back issues in the past, I've been fortunate I never needed surgery, but I was a teenager and I just remember how much that impacted me, and mine was gone within 6 weeks, but it's
Right.
still, I still think about it. For people who are living with chronic debilitating pain, it's tough. So it's really I feel very special and very blessed and humbled to be able to help people on their journey back to their normal, fun lives.
For sure. Was that one of the reasons why you got into working with the spine and back because of your own experience?
It really was. So, my
Really?
backstory, I was playing soccer when I was 17 in high school and I herniated a disc. And there were a couple of things that I really learned from it is that, as I mentioned, I got better without surgery, but I didn't know what the diagnosis was. I only know I herniated disc now because of, me being a
Yeah.
spine surgeon. Where I grew up in a small town in upstate New York and just didn't quite have the same access to care. The emergency department said, having my own personal experience with a back condition has really, motivated me and charged me to become a spine surgeon. A
Mm.
couple of things that I found for myself is, the ER where I went said I strained a muscle. I know as a spine surgeon I had a herniated disc. No one labeled it, and getting a misdiagnosis made my recovery maybe a little bit longer. That was one really powerful thing for me, is I really want to help people put a name to the condition, but also, how impacted I was when I was hurting, how impacted I was when I was back to normal, and also what I still carry with me. Oftentimes people, myself included, almost have this element of PTSD where when you have an
Yeah.
injury, whether it's mild and building with time or really almost this catastrophic disc herniation, it sticks with you.
Yeah. Right. You said impacted, and it's true. You not only have that physiological impact, but the psychological impact as well. How often do you see that with your patients? Like, do they actually have this fear, which probably makes everything even worse because they're very tense and holding everything, just from the fear of more pain coming?
I do. I think that a lot of times patients, especially post-surgically, almost have it and don't tell me. It's not something that sometimes people don't want to. They almost see me as a surgeon and say, "Oh, you're a proceduralist." And the reality is, it's not just the physical; it's the emotional. So I
Mm.
gather a lot of people have emotional PTSD about their condition, about their procedure, even when they're back to pain free, that they carry with them. I actually just saw someone today who we had a long conversation about it. She said it really for the first, she's pain free, so she's doing amazingly, but and actually I as well underestimated the emotional toll is going to take on her. What she noticed with her is more than just the emotional. She had her labs checked, and her cortisone, her steroid levels within her own body were very elevated. They see her adrenal glands, which can help release some of this chemical, were very much elevated. And I think it's because not just the physical response the body has to a surgery, but the emotional caused everything to be hypercharged and really
Right.
affected.
Right. That's really interesting. So, how do you approach that? I mean, you're a medical doctor, not a psychiatrist or a psychologist, but is there an element that you coach your patients in that has to do with this psychological part? Like, do you prep them and say this could potentially be an issue down the road, or make sure that you tell me if you're experiencing this, PTSD experience? How do you deal with that?
I always think that my role is to get people functional, getting back to their normal, happy lives. And as part of that, there's the physical, but the emotional follows, just like you said. I tend to share the story I just told about myself. The example I always use when I fly in a plane, like I'm very blessed. My back doesn't bother me. I've never needed surgery. But when I fly in a plane, I'm still paranoid about the landing hitting hard. So I always put my arms on the armrest and support myself. It's this funny little thing that my
Yeah.
body does. It doesn't mean anyone else has to do it, but I use that as a manifestation of my headspace coming out physically. I still have this notion I don't want to have another disc herniation. So a lot of
Yeah.
times I share that story with patients saying, hey, this is probably, I use the term PTSD. I say, you'll probably develop some element about that. So I think that getting ahead of it opens up the conversation and the more people know before going into a procedure, the better they do on the back end, acknowledging that may be coming.
Hmm. How much do you see the correlation between back issues and pain and psychological issues? Or is it just a physiological thing and then sort of the mindset around it comes afterwards? Or is it, I feel bad, I feel weak, I feel poor, I feel less than, and then we develop. Like, how does that all work? I'm
I think
always
it's
curious about that.
Yeah, I think it's more the latter that you said. There is this a bit of a debate in medical circles: is it chicken or the egg, right? Which
Yeah.
one is it? And I think that too often the default falls on, hey, here's someone who has emotional difficulties and has pain because of that. I oftentimes what I see time and time again, like there's a condition called fibromyalgia. I'm not sure if you heard of that, but it's
Yeah.
to summarize, it's basically pain all over the body that we can't explain.
Yeah.
And unfortunately, once people get that label of fibromyalgia, it sticks with them. Like they all of a sudden they can have a broken bone and someone says it's fibromyalgia because they just get misdiagnosed. There are many circumstances where we treat people with fibromyalgia and fix their fibromyalgia because it was never fibromyalgia. Oftentimes, what I see is there's a physical element, like you said, that causes you to hurt, causes you to change your outlook on life. You're not able to do the things you enjoy. And then when doctors say, I don't know what's going on, like well-meaning doctors, but they're not able to define the cause, all of a sudden people start saying, well, maybe it's in my head and becomes a self-fulfilling prophecy. In
Mm-hmm.
summary, I think that it's more commonly, at least that I see in my practice, people have a true condition and they almost were like the term oftentimes people use is medically gaslit, where they were told nothing's wrong with them, but they really had it. And it just caused them to go on this downward emotional spiral.
Mm-hmm. How frequently do you see people putting off getting help for their back pain?
A lot, a
Yeah.
lot. I think there are a variety of reasons. I know that with your demographic, it's a lot of very active women who have gotten to amazing places in their lives by almost deprioritizing their own health. So I
Yeah.
think that with this is an overgeneralization, but I think that oftentimes women postpone treating their back because they're the caregiver and superwoman working, getting groceries, picking up their children, taking their kids to sports games and deprioritizing themselves. And then oftentimes for men, I kind of feel like men sometimes kind of sweep it under the rug when they know there's something going on.
Mhm. Mhm. Yeah, I trained a client once who was an ER doctor, and she had a spot on her foot. She would train barefoot. And she had a spot on her foot, which I'm like, oh, that doesn't look good. And she's like, no, it's probably cancer. I'm like, oh, should you just go get that checked? And she's like, I literally don't have time. I know what's gonna happen, and I just don't have time right now. And she put it off and put it off, and then of course, one day she got it checked as I grew bigger and had A, B, C, D, and all of the different things that wasn't good about the mole. And it turned out to be melanoma and had gone into lymph nodes. But it's true. Like we have things that we know, might be wrong and we should probably get them checked, but we don't have time. Or we're too busy or we're not the priority. And so I think, yes, listening to your body is really, really important. Well,
Yeah,
what
and
do
one
you,
other thing I
yeah,
do
go
see
ahead.
actually with respect to that is a lot of times people, as a spine surgeon, they don't realize 90% of what I do is non-surgical. Most patients I see get back to their normal, fun, happy lives without surgery.
Oh,
So there is a hesitation, I think, seeing a specialist because they say, surgeon's going to do surgery. And that's certainly not the case with me or VSI. The other thing that we also see is there's just a lot of, unfortunately, misinformation about spine surgeries out there.
mm,
I saw a patient today who just had a surgery for a disc herniation, and he went from 9 out of 10 pain to 0 out of 10 pain less than 2 weeks after his surgery. He's comparing notes with his friends. His incision, he had what's called an endoscopic spine surgery. So his incision's half of a centimeter. It's tiny. And his friends and colleagues are having these 10 centimeter incisions and they're struggling. So
right.
the good news is that we have many better options than ever before. So it doesn't have to scare people in the same way.
Mm-hmm. Is herniated discs, is that a very common back issue?
It is. Yeah. So essentially what a herniated disc is, we have the discs or the shock absorbers in between the bones in the back. I like to think of them kind of like tires on a car. Over time, we can, wear the tires down, lose the tread. But when it happens gradually, oftentimes we're not symptomatic from that. What can sometimes occur, though, is that if it wears too much, a flat tire can simply hurt in the back. So there's both people having pain from degenerative disc, those shock absorbers wearing down with time, but also what a herniated disc can do, and that happened to me, is when the inside part of the disc, the jelly, kind of bursts out and ruptures to the outside component. It can press on a nerve and cause severe leg pain as well as back pain.
Hmm. And you said you herniated your discs playing soccer. Was that from hitting the ball, do you think?
It was just from a fluke twist. So I was running down the field, just twisted, and nothing abnormal happened. But that alone, just bad luck, caused me to have the injury.
Mm-hmm. So I like what you said that basically 90% of your help with people is non-surgical. So what sorts of things are you promoting and suggesting to your patients aside from surgical help?
I oftentimes, so I'll see patients sometimes when they're in the thick of things, where they just herniated disc or they just injured their back in some fashion or their neck. And the goal there is to say, let's calm it down, let's get you back to a more reasonable spot, and then look at the future. Then I'll also see patients who the goal is prevention. And I think there's a time and place for both. Ideally, we like prevention. So for
Yeah.
patients where we're trying to, this I think of myself, I like to tell people, I'm very dedicated. I'm very diligent. I work out every day, but it's easy to have my workouts not be as efficient or effective as I needed to. My back used to bother me a couple weeks out of the year, but then I started doing the proper core. For me, I'm fortunate. It takes me about 5 to 10 minutes a day. I don't have 2 hours to do on my core, but if I do my 5 to 10 minutes before my normal workout, my back just plain doesn't bother me. So that's part of what I think about core stability, good nutrition, proper mechanics. That's for prevention. For
Mm-hmm.
the longer term, some of the things, if someone's coming in with severe pain, then we're doing safe non-narcotic medications like anti-inflammatories. Fish oil and turmeric are very good natural anti-inflammatories. And then get into physical therapy with the transition, some athletic training.
Mm-hmm.
While you're looking at that, I also do have some higher level things that can be done. Let's say the physical therapy and exercises don't someone to that happy place. Oftentimes they're doing injections, whether it's steroids or actually a really exciting field. It's called regenerative medicine. So stem cells, PRP, using someone's own healing tissues to actually do the healing. Those are some of those higher level things that we're doing that span the gap of hurting but not needing surgery.
Yeah, it's interesting about the core work. Of course, I mean, we talk about that all the time too, how important it is, right, for your balance, stability, for posture. So, could you just maybe lay out some specific core exercises that maybe you do yourself or that you suggest to your patients that can help make us stronger in our core area?
Yeah, so I've seen some of your videos, and fortunately, you're doing them, so I love it.
Oh, good.
Yeah, there are different variations of, we used to think it was all crunches, all sit-ups, and the reality
Right.
is those are great for the muscles, but the more you kind of do this forward flexion, it puts a little bit of force on the disc. That's
Yeah.
why there's this trend towards moving away from that. Reality is the body is safe and strong enough to tolerate some crunches, but when we do a couple thousand a month, that's probably a little bit towards that overuse, right?
Right. Yeah.
So a lot of the exercises, and again, you're doing them. It's the stabilized core stability one. So
Mm,
planks, side planks, bridges, bird dogs,
yeah.
dead bugs, all the different variations. And again, you're doing a ton of these with some slight variations.
Yeah.
Those are the general ones that I recommend.
Hmm. And how frequently do you think that needs to happen in a given week in order to see some good results from that?
Everyone's a little bit different. What I've noticed for me, and there was one time I took a vacation. I was not as diligent with my exercise. I took about a week off from doing core. And come day 7, I started to notice my back talking to me a little bit. And
Hmm.
I don't know if it was pure happenstance or was
Yeah.
truly based off of me not doing my exercises. But I noticed in that one time, 7 days, I started noticing my back again. I
Yeah.
do my core, if not every day, every other day. I don't
Wow.
think it has to be that much
Yeah.
necessarily. Everyone's a little bit different, but that's kept me at bay for the last 10 years of not really noticing my back.
Yeah, and I think training in general, like you're thinking of some of your heavier lifts, maybe your deadlifts, your squats. I mean, core has to be activated in order to have good form and to, perform the move correctly and safely. So I think if you're training regularly as well and adding core moves on, like you've mentioned, that's probably a great you put yourself in a good position for prevention for sure. Now, women in menopause, obviously, we have lost estrogen, right? So estrogen is gone. Talk to us about how that directly impacts our spine, the discs, the vertebrae, our stability. Like, what is going on, and what have you seen in women my age as we lose estrogen?
So unfortunately, we're on this descending health pathway, myself
Ah.
included. We peak in the 20s, late 20s, and then it's this
Yeah.
gradual decline. And then, as you mentioned, especially with perimenopause, hormonal changes, then we kind of see this second accelerated potential for deterioration. Hormones, estrogen specifically, is critically important when it comes to the musculoskeletal system. We think about estrogen with respect to maintaining collagen or the type of protein that is critically important in bones, discs, ligaments, tendons, all the stuff that makes us move, and hopefully the stuff that prevents us from hurting. So we know that bone health, the bones get weaker as we age. That's one of the probably strongest correlations we've seen with declining estrogen. We also see more of a tendency for the disc health, those shock absorbers I was referencing, as well as different ligaments in the body to gradually deteriorate, get a little attenuated or stretched as well.
Mhm.
And that can loosen up the body, potentially making us more prone to some injuries.
Yeah. Menopause hormone therapy is indicated for the prevention of osteoporosis in the States. It's not indicated for that in Canada, although I know a lot of physicians who recommend it for that, but just according to the Menopause Society and their indications. But why is the spine especially vulnerable to that bone loss in menopause?
So it's the spine itself is relatively is a very complex structure. Since we walk upright, we put a lot of force through our low back, and we need this orchestration of all these different body parts to make our back work properly. We think about the muscles, which I didn't mention, but estrogen is critically important to maintaining muscular strength. Think about all these different ligaments, whether they're in the disc or on these areas in the back called the facet joints. And then we think about, very importantly, the bone health themselves. One of the defining types of fractures we want to prevent that defines osteoporosis is something called a vertebral body compression fracture, where instead of having a rectangle, it gets squished down and becomes a bit of a triangle.
Hmm.
This is one of those injuries that we unfortunately see with some regularity as bone health gets weaker. That's something we very much want to prevent, just based on the way we carry our weight in our body.
So how would we prevent that?
So optimal health, optimal nutrition. I always think good spine health is good, or good overall health is good spine health.
Right.
So we really want to eat, another phrase we use all the time, eat the rainbow. It's best
Yeah.
if we get the proper nutrients, all natural, but there's absolutely a role for medications, and then prior to medications, probably some calcium, vitamin D supplementation.
Hmm.
That combined with good strength training and exercise as well as weight control is probably that happy balance that hopefully we try to achieve.
Do you have any stats or just in the patients that you've seen of women who are on hormone therapy versus women who aren't? Like, do you see more women who aren't on hormone therapy come in with spine issues or disc issues?
I would say more, most likely more who are not, largely because most of the patients I see are actually not on hormone replacement therapy.
Yeah.
So unfortunately, I feel like we're kind of, what we do in medicine. Sometimes I mentioned so much about prevention. A lot of times we're in that treatment phase where, shoot, you already had that compression fracture in your back. Now we're playing catch up to both heal
Yeah.
that as well as prevent more. So I'd
Right.
say more people I see are have pain who are not on the replacement therapy, but it may just be those are the patients I've seen predominantly.
Well, and what's interesting is my mother's generation, which is probably a lot of, maybe that's a lot of people that you're seeing, but they weren't doing strength training, right? I mean, that was not something that was prioritized. Women for sure were not in the weight room, but this is changing, which is phenomenal. And so hopefully in the years to come, maybe even with the 20-year-old, 30-year-old generation, when they get to be 50, 60, you won't be as busy.
Yeah, that's the goal. It's you're right. I think there's this philosophical change in society. Like, my wife kind of she's got this callus on her hand from strength training and playing tennis, and she wears it
Yeah.
as a badge of pride, right? She's
Oh,
not this
totally.
super muscular person. So she definitely is like, I remember with her in her 20s, she's basically using elliptical and running, which is
Yeah.
great from a bony strength perspective, but wasn't doing a ton of exercise. And she's now it's doing just like, I mean, what you're promoting, having the workout classes and the strength training, I think is huge.
Yeah, it's funny about the calluses. We were just on vacation last week and we were in the pool and we were comparing calluses, my son and my husband and I.
Yeah, who's got the best one, right?
Who's got the best calluses? Yeah, that's awesome. It is definitely a badge of honor. When we're looking at sort of the perimenopause stage there, what are maybe the top three things that we can begin to do or add into our routines, that can help protect our spine, that can help protect, the bone density back there? I guess it's not just back there, it's all over the body, but yeah, let's get practical and name some things that we can do.
So I would say first is actually the weight bearing exercises and strength training.
Yeah.
I think that, it's the beauty of an advanced society is that we're not baling hay routinely as much, but we're
No.
also sitting down a lot more.
Yeah.
So we're
Yeah.
not utilizing our bodies the way that, we once were. Weight bearing exercise, strength training is critically important. Like swimming's a great exercise. It's wonderful for the core, but it doesn't do much for the bone density. The
Right.
bones to get stronger want to be stressed.
Yeah.
So I'm a big fan of weight training and weight bearing exercise as well.
Yeah.
So that's probably my top one.
Yeah.
And to put a qualifier there, you don't have to be squatting 200 pounds. In fact, as a spine surgeon, I probably don't want you doing that. There's a lot of great body weight exercises. You can use light dumbbells in the arms and do, deadlifts, squats, all the things. There are all these excellent exercises that can be done.
Since you mentioned that, what are maybe some contraindications in terms of exercises that we might want to avoid if we have a more fragile spine or if we don't want to end up having to see you?
Yeah. So one of the first ones I say is kind of the common sense test. If something doesn't feel right, don't do it.
For sure.
So for whatever reason, and I think it's because my mechanics are off, I can squat fine, but my deadlift, I always feel a little weird about. And I don't know why, other than I think it's just my form. There was one time I tweaked my back doing a deadlift, and I've always been paranoid since then.
Yeah.
I think deadlifts are great exercises, but for me, I tend to trend more towards squats and lunges instead.
Yeah.
That's an initial litmus test I use. If something doesn't feel right, don't do it. I don't love, even like pro athletes, heavy bar squats, putting the weight on the back, going super heavy. It just impacts the spine tremendously.
Yeah.
So that's another one. I tell the people pretty much avoid the heavy bar squats because even in people who are pro level athletes, there's an alternative pistol squats, basically a single leg squat,
Yeah.
again with a body weight is hard,
Yeah.
incredibly hard. So I tend to tell people avoid things that don't feel good and then the heavy bar squats.
I trained a few people who have had the dowager's hump. Like, so this is the rounded hump on the top of their back. We see it mostly in women. No one wants that. How are we going to prevent that from happening to us? My mother-in-law, she just passed, but she had that, and I could see it just slowly over time. Every time we would see her, be like, oh, it's getting worse and worse. And I'm like, oh, pull your shoulders back and stand up tall. But it's like it was too late. It's like already rounded. Is it too late once we have that rounding kyphosis in the back? Can we ever straighten it out? But how can we avoid that?
I think prevention is most critical here. So there are some, fortunately, we don't have to do them too often, but when people are really kyphotic or forward hunched, like you mentioned, once it becomes fixed, like the bones are healed that way, the only correction is a very large spinal surgery, which they
Mhm.
work well. We just certainly want to avoid that if at all possible. I was just having a conversation with a woman who postmenopausal, this exact discussion where she said over the last year and a half or so, she's starting to notice herself hunch forward a little bit,
Yeah.
causing her muscles to be a little irritated. She knows her posture's off. A big thing is there are kind of two general categories how this happens. One is if someone has one of those compression fractures I was referencing, that can cause kind of a sudden punch forward because the
Mhm.
bones aren't held upright. Once that occurs, that's more acute, quick onset. We certainly want to avoid that by optimizing bone density.
Yeah.
For the more dramatic long term, the discs get a little bit shorter, the ligaments get stretched, and it's more voluntary. It starts and then just gets bigger and bigger with time. Some of the things we think about, I want people to sit upright, you know,
Hmm.
raise that computer monitor relatively high. When they're sleeping, I tend to use a flatter pillow as opposed to one of those huge ones that pushes me up.
Hmm.
But then also, this is an oversimplification, but we tend to do, when we're working out, we tend to do the exercises in the front, right? Because we're looking at our front. So we visually, it kind of tracks more. I would say people do more chest than traps, lats, and the back work.
Backwards. Yeah.
I
Yeah.
tell people in general, if you kind of divide your spine, like your back in half, if you're hunching forward, we want to over strengthen the back side to help balance that out, tighten things up, and be able to hold yourself upright for longer.
Yeah, I think sitting at a computer for an extended period of time, I could definitely get lazy, right? I just sometimes will notice myself just like, "Wah," and I'm like, okay, time to stand up. I have a standing desk, which I think is helpful because it does change your positioning and changes your posture. But yeah, it's easy to begin to do that. And I work out all the time. Like I do exercises that try to keep my shoulders back, right? And train my back muscles and stretch through my pecs. But even still, I find that, time is just beginning to do this a little bit more. So if we did nothing, we're going to be even more trouble.
Acknowledging, I think, is the first and most important part.
Yeah. How much does hereditary factors come into play here? Like if mom had it, will I get it? Can I avoid it? Is that pretty a strong factor?
It is a factor. I wouldn't say it's the strongest factor, though. There are certain conditions that we know seem to run in families. Like one's called scoliosis, so when someone has a big S-shaped curve in their spine.
Hmm.
I will say I tend to find fewer people where it's genetics that cause their discs to break down. The analogy I like to think of is, using the discs, thinking of them as tires on a car. Certain people have 50,000-mile tread warranties, and certain have 5,000-mile warranties. But even if you have one of those high mileage tires, you hit too many potholes, you're going to get a flat. So
Yeah.
there's this element of genetics that we have as well as the life we've lived. While I
Yeah.
think there's a component of both, I would say in general, I think it's probably more of the life we live, the micro injuries, the posture, the suboptimal body weight, with occasional genetics thrown into play that cause things to break down faster.
Yeah.
So there's hope. If your parents have it, doesn't mean you have to have it.
Right. Yeah. And strength training is, yeah, that is so crucial as we age here. Have you heard that it's like over on TikTok or Instagram, people will come on and they're like, as a neurologist, I would never. Well, as a spine doctor, what are some things that you would never participate in order to protect your spine?
One, I mentioned the bar squat. I would definitely avoid that. That's honestly probably the biggest one.
Just seen so many injuries with the barbell squat.
I have. I've seen a combination of acute injuries where someone goes super heavy and then has this catastrophic disc herniation. And then I've seen ones where people say, oh, I'm going to start really working out my legs. They go crazy heavy with the bar squat. Then 3 years later, I see him again. I've seen a lot of deterioration over the disc at that time. I tend to have this viewpoint on the spine and the body in general, where our bodies are designed to move. I want people to have this happy balance of not being worried about injuring their back, so living life the way they want, but being smart about it at the same time.
Yeah.
Our
Yeah.
bodies can tolerate weight, but if they're certain, because especially with the bar squat, as I mentioned, that pistol squat, lunges, just regular squats with dumbbells. I think we have so many better options
Mm.
that still achieve the same goals but don't have the same risk. That's why I'm saying avoid the bar squat.
Yeah, we've seen so many like extreme bodybuilders who are just debilitated now. They can't even walk, they can't even move. That could be the downside to it as well. I don't do a lot of those because I mean I have a barbell, but most of our viewers are just using dumbbells, so we'll rack them up onto our shoulders. It's going to be whatever you can curl up to your shoulders, which for me
Yeah.
is only going to be 25 pounds per hand or
Yeah.
30 maybe max.
Well, I guess I should get a clarification. I'm really thinking of the that amount's fine. I mean, we wear backpacks, right? We wear
Yeah.
weighted vests sometimes that are that much, but 225, 325,
Yeah, for sure.
there's some better alternatives in my
Yeah, be
opinion.
cautious. Oh, you said it, so I'm going to have to follow up with this because people will ask, what are your thoughts on the weighted vest? I mean, it's been very polarizing and controversial in the social media space. And years ago, we used to use them in training, for specific events. I had trained for this sort of strong woman. It was like a strong woman meets tough mudder competition. So we were doing some step ups with the weighted vest. Anyway, fast forward last year, the weighted vest totally blew up from some influencer doctors online, basically saying that it should be worn all of the time in order to prevent osteoporosis. What are your thoughts on the weighted vest? Is it necessary?
It's not necessary, but I actually think it has a role, and I like it. I think that it's, the truth's never all yes or all no. I
Yeah.
think that there are many circumstances that can be helpful, but I think there's some that are where it's not ideal.
Mhm.
Walking through this a little bit, basically, if someone has back pain, don't wear it. Like, why stress something more if it's already bothering you?
Yeah.
I think it's essentially kind of has the potential of being a little bit of a cheat code. I think it can make an already good exercise potentially even more effective in the same amount of time. What I tell people is start off with, if you never used it before, start off with like 5% of your body weight, go super light. A more normal or a steady state to achieve is probably about 10% of your body weight. And then when people are really going heavy for the ones who are kind of pros in it, max out about 20%. So I
Hmm.
think, ideally trying to get about 10%, but I think it's really good. It has the potential of making someone's exercise more effective. It can take walking to being going from, like the 101 course to almost a 201 course. One area that I think it's pretty beneficial and something for myself as well. I used to tell people that walking's good exercise, and I used to kind of say it, but not fully believe it. And then two things I always thought it's good for them, but I want to be running. For me, what I've noticed personally is that walking, I think for me has become really good exercise when it's done for a certain distance, when it's done on an incline and with a weighted vest.
Right.
An incline and a weighted vest hits differently than
Oh,
sprinting a mile. Different
yeah.
ball game in a good
Yeah.
way.
Yeah, I agree with that. I'm a daily walker, so I definitely think that it is exercise and can give us so many other tremendous benefits as well. And that's interesting about the weighted vest, though. But yes, I think when people have pain, why would you compress any further? Another argument I think people have made about it as well. They've said, I just lost, 20 pounds. Now I'm going to put another 20 pounds back on and wear a weighted vest. Does that make sense? What do you have to
Yeah.
say about that?
Well, on an episodic perspective, I think it does. I mean, obviously, we want the more weight off, if it's not ideal types of weight, the better. That's for 24/7. But, it's like we work out, we use weights. So
Right.
on an episodic level, I actually think it's quite good. I would not wear it all day long, but if someone's going on a walk, I think it's great.
Yeah, that's a good point. I like that. Anything else you'd like to tell our listeners today about how to protect their spine, things to do that are just that you've seen have made a big difference in your patients?
I think that calcium and vitamin D supplementation is something to really consider. For a while, vitamin D was seen as this wonder drug and cured everything from headaches to cancer. I think that was overblown. But from a bone health perspective, calcium and vitamin D, we're seeing it that it's massively under ingested, that we're not getting enough in our diet. Not
Mm-hmm.
only are we not getting enough in our diet, we really need to activate it with sunlight. So it's supplement and then get out and get that sunlight. So from a supplementation perspective, I would say calcium and vitamin D is probably some of the best data, and I've had some of the best experience with that. And
Hmm.
then ultimately, when it comes to it, let's say all the prevention in the world doesn't get someone to their happy spot. The good news is we got all these new treatments, and it's not old school fusions of the back necessarily. We've got disc replacements, stem cells, regenerative medicine, and a lot of times, as you and your viewers know, just optimized exercise can be the fix. So it doesn't have to be scary to speak to the spine surgeon.
And I read too that you performed the world's first endoscopic and robot-guided spine surgery. How was that?
Yeah, sounds very fancy. So
It
basically,
does. You're
the
like, it
premise
wasn't that.
behind it, yeah, endoscopic is a tiny camera, and robotics has allowed us to dramatically improve accuracy.
Sure.
I always think of it kind of like, if you've ever had that experience where, you knock your cell phone charger out at night, and then for me, I try to fumble and plug it in. Eventually, I can't do it. I got to turn the light on and plug it in.
Yeah.
Like robotics, a lot and endoscopic both allow us to almost put on like X-ray goggles and just
Mm,
plug goes right into that spot. These are
yeah.
ways that we can improve accuracy in surgery, but through tinier incisions, so it hurts a whole lot less. It's much more effective and accurate.
Hmm. That's kind of cool because I know my sister had back surgery years ago and she's got a big old scar across her back. And but new innovations and AI, that has been a good thing to have that with us. So I know I've just watched a bunch of videos on AI coming and what to be afraid of, but we definitely have some good points to it as well.
Pros and cons of all the new technology, but for, at least in the field of spine and how I view it personally, I think it's
It's a
about,
good thing.
yeah,
It's
being ethical about it. Sometimes, I don't want to, just because new technology is there, I'm dealing with people's backs, their necks, and their lives. So I don't want to jump on every new technology, but I want to
Mhm.
really adequately vet it to make sure
Yeah.
that it does have roles to avoid those big muscle cutting incisions. And so there's a lot of really promising technology out there.
Yeah. Do you practice with that robot on like a cadaver or something before you did it in a person?
Yes, yes. So there was a basic, a long training program as it should be. I was part of a team that actually, once I was up and running and really became extremely high level with it, we did a lot of teaching of doctors. So
Mm.
there's typically a kind of a pedagogical training program. You start with, they're called sawbones or basically fake skeletons, then some cadavers, and then eventually, hopefully, proctoring with surgeons who are very comfortable and adept in doing it, and then with a gradual transition to their own.
Hmm. Well, very neat. That's a very interesting field. And thank you so much for being my guest today and sharing all of that with us.
I really enjoyed it, Tracy. Thank you so much.
Where can people find you, work with you, contact you? I don't know if you have telehealth going on, but let us know where people can follow you.
Yeah, so we actually that's very helpful. We do telehealth, so we do it within the states. I have a number of patients who are Canadian actually as
Oh,
well who
oh,
we do
neat.
telehealth with. Because I know that there are pros and cons of every system, and there are many ways, in my opinion. I think Canadian healthcare system's awesome. I do know that if you hurt your back,
Oh,
sometimes the waits are long.
years. Yeah,
Yeah.
very
So
slow.
that's one of the challenges that a lot of my Canadian patients have seen. So at least just,
Mhm.
as I said, getting a name to the diagnosis is critical. So at our website, vsispine.com. Also on my Instagram as well. We put a lot of tips and tricks out there at Dr. Colin Haines, MD. So
That's excellent. I'll share all of those in the show notes below. So head on down there right now, folks. Take a look, follow Dr. Haynes over there, and reach out if you're in a spot where you feel like you need some help with your back and spine. All right, folks, thanks for listening today. As always, go move daily in your fitness, your wellness, and nutrition. And we'll see you all in the next Move Daily Talks.